On behalf of Sutter Novato and Sutter CPMC, welcome to our Ask the Expert session on neck and back pain treatment. If you're hurting, you've come to the right place. Tonight, you'll learn about the causes of neck and back pain, along with some of the latest treatment options with Dr. Katsuura. We're really grateful for this webinar technology that we have, and just a couple of housekeeping items on how an online webinar works. We can't see or hear you, so if you have a question for the doctor, anytime during the presentation, scroll your mouse or pointer over the Q&A button, which is on the bottom of your screen, somewhere about there. And then click it, ask and type in your question. Dr. Katsuura will answer all the questions at the end of his presentation. And when the webinar is completely over, a survey referral form is going to pop up in your browser on your computer screen. And the form is going to have a section for additional questions you may have, feedback about tonight's session, and an option to schedule an appointment with the doctor or consultation if you're interested. And just in case you don't see the form pop up on your computer tonight, don't worry. We're going to send it by email to everybody tomorrow. So sit back and relax, and let's get on with the presentation. We are very fortunate to have Dr. Katsuura with us tonight. He's a board-certified orthopedic surgeon who specializes in complex spine care. He really believes in using surgery only when it's necessary and maximizing the use of the latest surgical techniques. Dr. Katsuura received his undergraduate degree from the University of California at Berkeley. He attended medical school at the Royal College of Surgeons in Ireland. He completed an orthopedic surgery residency at the University of Tennessee College of Medicine, and he fulfilled a fellowship in spine surgery at Cornell's Hospital for Surgery in New York. He's also the author of the Spine Encyclopedia, which is a great book about caring for your neck and back, and it's available on Amazon too. But most importantly, Dr. Katsuura has outstanding treatment outcomes. His patients consistently give him top ratings in resolving their pain, and he's a nice guy on top of it all. So despite a very busy schedule, we're grateful he can make it here tonight. So with that, please welcome Dr. Katsuura.
Thank you so much, Sean, for that great introduction. I really appreciate it. Tonight's topic is why your spine matters, and we're going to be discussing medical care for the aging back and neck. So this little pamphlet here displays my overall treatment philosophy, and I believe really in the complete assessment of the spine, and I think that starts with the overall evaluation of the individual. And spine surgery and spine care is very complicated, and so I pride myself on being very precise and thorough in that assessment. But I also understand that dealing with the spine can be a very scary topic for a lot of people, and so I try to deliver my care in a compassionate way that reduces stress, fear, and anxiety. We know that the world of spine surgery is very confusing for patients, and I certainly see that in my own patient population. And if you've ever had an MRI or CT scan and looked at the radiology report, you'd be surprised to know about all the awful conditions that the radiologist is listing that you have. And that can be very, very scary for patients to read and can cause a lot of anxiety, as you would expect. And if you Google the back conditions and start going down the rabbit hole of internet exploration, and you're going to find an endless amount of bad information, with ranging from miracle cures for back pain, various devices that should be implanted, various surgeries that are recommended. And overall, this can be overwhelming for the layperson who may not have a background in medicine. And so to demystify this process, I wrote, as Sean very kindly alluded to, I wrote this book called The Spine Encyclopedia. And really the goals of this book are to help the patient and maybe even some physicians navigate this very complicated world of spine treatment and all these various gimmicks and miracle cures, and to learn about how to appropriately care for the spine and when surgery may or may not be necessary if that's something that is to be considered. So if you own a back or you own a spine, this may be something that you can look up in the future, or especially if you're considering undergoing a surgical procedure. So let's start the talk with this image here. And I really, looking at this, I think this image demonstrates the apex of what your spine can do for you, or a kind of apex for what your spine can do for you. And in this picture, you notice that the person is enjoying their life. They've just finished a very long hike. They've reached their destination, and they're elated to bathe in the majesty of nature. They look around, and everything is good. Now, I'd like to ask is, at this moment, do you think that this person is thinking, well, thankfully, my spine is working perfectly today? I would suggest that this person doesn't even realize that they have a spine at this point. They're just enjoying their life, and they don't know what their body is doing for them. And the spine is a passive structure. It sits in the background, and it does incredible work for you as you enjoy your life in this upright fashion. And it's very rugged, it's very durable, it can handle a lot. And so you don't really notice it as you go through your life. But I have a somewhat different perspective. I look at this picture and I see maybe something different than the average person does. I see that this person is wearing a very heavy backpack. And even though it may be supported partially by their hips, you can see that the person's bending forward slightly and to accommodate this very heavy load. And this is putting a tremendous amount of strain on their spine when they don't even realize it. I see that they're slightly pitched forward. I do see that they're using a walking stick here to help balance, and that they're precariously standing on this slippery rock, which they could fall from at any moment. And that's just looking at things through the lens of an orthopedic specialist. And I also see how we transform over time from this very active, capable body to someone who maybe does realize that they have a spine. And in the picture on the right here, I would suggest that this person is reminded every day that they have a spine, because they have spinal deformity. They no longer can stand upright. They may have constant back pain being in this position. They can no longer walk unassisted. There's been a loss of stature. They're no longer as tall as they once were. And during this talk, we're going to be exploring this transformation from a healthy to an unhealthy spine, or an aging spine. And we're going to talk about some of the things that go wrong and what we can do about it. This is the outline for the talk tonight. I think we're going to talk about why it matters, and why the spine matters, what happens to the spine through the aging process, and when things go wrong, what can we do about it? This is my disclaimer for this talk. In my clinics and in my practice, I treat the individual. I don't treat an X-ray, and I don't treat a specific problem. And so the treatments for spinal care are very nuanced, and there's a large array of different treatments that we can use. And so unless you're completely ready to hand over your health to ChatGPT, I feel that these decisions are best made in coordination with a spinal expert or a physician. Tonight, we're going to be showing some examples of different treatments, and I just want to remind everyone that the details of the full spectrum of spinal treatments are really beyond the scope of this talk tonight. And I just want to kind of give you a flavor for some of the things that we can do to fix a broken back. So why does the spine matter? The spine is important principally because it connects your torso to your lower extremities, and it allows you to balance your head and arms over your pelvis and your legs. And it's the link between these two areas of your body. It can allow you to carry objects and move them around, and as your legs move, you can balance perfectly, holding objects in front of you or behind you or at your side, and your spine adjusts and accommodates to allow you to do this. If you were to drop an object, the spine allows for bending and twisting, so you can pick it up and retrieve it in a very flexible and fluid fashion. And your neck also has a lot of motion, so if you need to look at something over your shoulder, your neck can turn around, and it's this very versatile structure. The spine is also important for another reason. It is the housing and the casing and the protective apparatus for your neurologic system. And so that mainly consists of the spinal cord and the nerve roots as they run from the brain to your arms and legs and body. And the nervous system is responsible for all the principal activities of your body throughout the day. It's responsible for your balance and allowing you to stay upright and to jump around and do different things, a sensation of the extremities so you can feel and touch different things, motor control of the arms and legs so you can walk in a coordinated fashion and have good handwriting and draw pictures, do different things. It's responsible for the continence of your bowel and bladder, and also for sex. This is a schematic of the spine, and the spine consists of three main regions that are clinically relevant, and that's the cervical spine, which is in the neck, the thoracic spine, which is in the upper back, and the lumbar spine, which is the low back. And each of these areas are composed of vertebrae and discs. And each various region of the spine has its own characteristic curvature. In the lumbar spine, we call it lordosis, and in the thoracic spine, it's called kyphosis. And again, in the cervical spine, it's lordosis. And these curvatures are important for a reason I'll explain to you in just a minute. If we boil down the spine to its most basic components, we have what we call a segmental unit, which is a vertebrae, a disc, and another vertebrae. And these you can think of them as links in a chain. They allow motion to occur throughout the spine in a controlled fashion. And during this talk, we're going to be using this little schematic that you can see here on the left of the screen to represent the segment to demonstrate various problems with the spine. So I mentioned earlier that the curvature of the spine is very important. And the reason that it's important is it allows you to stand up with very minimal effort in a very balanced fashion. So if you're healthy and you have a normal spine and you stand up, you may notice that you have very little muscle activation. You're not straining, and you can almost just stand on top of your legs in this way that doesn't require any effort. And it's the curvatures of your spine that allow you to do this. But the spine can also meet higher motor demands. Obviously, it's important for bending and twisting in these rigorous activities such as tennis or golf or hiking, and can really deliver a very high level of performance. Speaking from my experience as an orthopedic surgeon, I can tell you that you can live your life perfectly normally and have a very robust and active life without a leg. But I would argue that the same is not true for those who have back problems. Even trivial motions become painful for someone with a back or neck problem. Getting up from a chair, getting out of bed, moving, going to the bathroom, these things can become very painful. And that's another reason why the spine is so important. So let's move into the meat of the talk and discuss what happens a little bit when we age. So you may have heard the term disc degeneration. That's a very common term that you see it in radiology reports, and you see it all over the place. And what that basically means is we all start out with these very healthy appearing gelatinous discs. They sit in between the bones, and they're responsible for absorbing shock between the bones, and they're also responsible for allowing motion. And as we get older, these discs become gradually disintegrated, degenerated, they crack and fissure. Ultimately, they totally wear out, and the bones respond by forming bone spurs, which is illustrated a little bit better in this cartoon here. Here we see the healthy disc resting between the two vertebrae, and as the disc degenerates, the bones settle upon one another and start to form bone spurs, and these bone spurs can encroach onto nervous structures. Another phenomenon that occurs when we age is what we call osteopenia. And what that means is the strength of the bones is actually reduced as we get older. There's no longer a rich deposit of calcium in the bones, and the overall structure of the bone degrades, causing them to become weaker. That's a process called osteopenia and osteoporosis. So if we put all these things together, we can see that the disc degeneration can ultimately result in the loss of lumbar lordosis, and that we can have osteopenia and wedging of the vertebrae that can result in a worsening of our stature. So we're going to start talking a little bit about how these problems occur and how we go from someone who's upright to someone who looks more like that picture that we saw in the very beginning of the talk. And three of the main problems that occur, and I call it the triangle of pain as we age, are degeneration and stenosis, osteoporosis, and spinal deformity. So let's talk a little bit about osteoporosis. And with osteoporosis comes compression fractures. So here we have the normal spinal segmental unit, the vertebrae, the discs, and the vertebrae again. And as you get older, the bone loses some of its strength. And what that means is it may lose some of the calcium, which is responsible for the overall robustness of the bone and the strength. And then the internal structure of the bone can degrade as well. And that's just part of the normal aging process that occurs to 100% of human beings over time. As the bones start to get weaker, they become more susceptible to fracture. And when they fracture, they typically fracture in this type of configuration. And we call this a wedge compression fracture. And this, as you experience osteoporosis, can occur under trivial forces. In some patients, I've even seen a hard cough or sneeze can cause these kind of compression fractures to occur if your osteoporosis is bad enough. And so this is a very, very common phenomenon. What are the clinical symptoms of osteoporosis and compression fractures? When these compression fractures occur, they can cause a change in the shape of the spine and change in the stature of the spine. That's kind of depicted in that previous cartoon, but it can also result in severe back pain. We lose that upright balance that we've had and that effortless ability to stand upright. When you have a wedging of the spine and you lose your curvature of the spine, now all of a sudden your muscles have to fight to hold you upright. And the muscles fatigue and that can generate significant back pain. The fractures themselves are also painful. And this is a very common phenomenon. Over the course of my talk tonight, probably a handful of compression fractures have occurred in California. It's estimated that compression fractures occur about 1 every 22 seconds. And so it's fairly common for these things to happen. And it's more common in females, although males are not excluded. Females experience osteoporosis earlier than males because they undergo menopause. And it's estimated that about 40% of postmenopausal women will have a compression fracture. Men experience compression fractures as well. It typically starts about a decade later than females do. The symptoms range from asymptomatic, so these can be in the background. You may not even notice that you're having them, and they can range to incapacitating and cause severe pain and cause patients to go to the emergency room and seek out medical care. And there are lots of different treatments for these types of fractures, ranging from physical therapy to medical treatments. But one of the treatments that I want to highlight tonight is called a kyphoplasty, which is a minimally invasive procedure that we use to treat these fractures with a great deal of success. And this video here demonstrates how the kyphoplasty procedure is performed. We use a small needle to access the vertebra and inflate the vertebra with a balloon and then fill that cavity with cement. And that cement fills up the cracks of the bone and basically shores up the strength of the bone, replacing some of the bone that you may have lost, and can greatly relieve pain. Another more modern technique that we have is called an expandable titanium device. And this is really a powerful technique that you can see here can reinflate the vertebrae back into a more normal shape, not back 100% to where it was, but much closer to a more anatomic shape of the vertebrae. And that's a tremendously powerful procedure that is available for us. So studies, randomized controlled studies have looked at this in great detail, and we know that these treatments are extremely effective in alleviating pain from compression fractures, and not only alleviating pain, but can actually improve overall patient survival. As you can imagine, having one of these fractures can be incredibly debilitating. It can cause you to be in bed rest, and being in bed rest is really bad. It causes rapid deterioration, and so we want to get you moving as quickly as possible after having one of these. And if you're in extreme pain, that's difficult to do. So treating with kyphoplasty can help alleviate the pain and can actually improve your overall survivability. So in summary, osteoporosis and compression fractures are very common. There's a lot of different treatments that we have for them. In some cases, we may consider kyphoplasty. Let's move on to discussion about degeneration and stenosis. Stenosis is a term that you may have heard thrown around, and I want to explain what that means tonight. So let's go back to our diagram. Here again, we have the vertebrae and the disc. And we're going to add to this diagram a little bit. I mentioned to you earlier in the talk that the spine houses the neural elements, the nervous system. And so it does that within the spinal canal, which is illustrated here. It's basically a tube that is hollow and allows for the nerves to traverse from your brain to your body. And so as you experience disc degeneration, sometimes the ligaments around the spine become what we call hypertrophied, which basically means they've become thickened. You may have bone spore formation, the discs may bulge, and all of these things can encroach upon the spinal canal. And that results in a condition that's called stenosis. Stenosis just basically means narrowing of a tube. So the spinal canals become narrowed, and as that happens, the nerves don't get any more room. They have to occupy less space. They become pinched, and that is an extremely painful condition. So we call this stenosis. So what are the symptoms of stenosis? So when stenosis occurs, it can cause a localized back pain. In addition to this, you may have heard the term sciatica. Sciatica basically just means that pain is traveling down the legs in the distribution of the nerves that are going down your legs. In addition to pain shooting down your legs, you may also have numbness of the legs, weakness of the legs, and that's a condition called radiculopathy when that occurs in conjunction with the leg pain. When this condition occurs in the neck, the symptoms are somewhat similar. You have a spinal canal in the neck just like you do in the low back, and you can cause pain that's shooting down your arms. It can cause your arms to go numb. But one important distinction to make is that in your neck, you have a spinal cord. You have nerves and a spinal cord. In the low back, you just have nerves. And so when compression of the nerves over the spinal cord occurs, it results in a more sinister condition. And you can start to experience basically lose the coordination of your arms. You can become clumsy with your arms, your handwriting can become deteriorated, your balance can be lost, and this is a much more sinister condition, which we call myelopathy. This requires urgent medical attention if you start to develop these symptoms. And I've had patients who have told me, oh, I'm just getting old, my handwriting's not as good, my balance is not as good, I'm just getting old. Well, that may or may not be true, but I've seen patients who have had severe spinal cord stenosis in the cervical spine, which is a condition that can be treated, have relief of those symptoms after treatment. So spinal stenosis, just like osteoporosis, unfortunately, is very, very common. It's one of the most common reasons for surgery in patients older than 65. And there's a lot of people in the United States who are suffering from this condition. It's estimated that around 50% of patients have some form of anatomic stenosis as you get older. Young people may not necessarily be excluded from this, but it certainly is more common as you get older and your discs have degenerated and you have the opportunity to form more bone spurs. So what are the treatments for spinal stenosis? Well, physical therapy is a treatment, and certainly that can improve your function and can perhaps delay surgery. Studies have shown that it does not necessarily change the pain as related to spinal stenosis. Steroid injections, or as we call epidural steroid injections, which is performed by spine surgeons and pain management surgeons or pain management doctors, basically is when you take a needle and put it around the nerve and inject a small amount of steroids and numbing medicine. And that can be used to treat the pain from stenosis, can be used to treat sciatica pain and radiculopathy. For severe spinal stenosis, though, they may not offer long-term relief or long-term benefits. And so ultimately, in a case of severe spinal stenosis, we may be looking at surgical options. And one of the main treatments for that is spinal decompression. And I'm going to show some images from surgery. So if you're a little bit squeamish, please take this opportunity to just look away from the screen for a couple slides, and then we'll get back to non-surgical pictures. So this, I think, is a really interesting case. This is a patient, and we see here, this is the spinal cord, which has been exposed. And then you can see this huge bone spur that's pinching and compressing and deforming the spinal cord and the nerves as they exit the spine. It's an incredibly painful condition. It's like, imagine having a rock in your shoe, but you can't take the rock out of your shoe. You have to live with this rock in your shoe all the time, just constantly causing you pain. And so spinal decompression is really just removing some of these bone spurs. And you can see in this video here, we just scoop these out, and it's instantaneous relief. The spinal cord returns to its normal shape. The nerve is no longer pinched, it's no longer stretched, and the patient has just tremendous relief from getting these bone spurs out. And so it's not just about my own personal experience with this, but many randomized controlled studies have shown that this is superior to non-operative care. So care with physical therapy or medicines and injections, which may not treat this anatomic lesion in the back. And it's very successful in relieving back pain and leg pain. And this has been extensively studied in the field of spine surgery. So in summary, spinal stenosis is very common, and it is debilitating when it occurs. It causes severe back pain, leg pain, can result in motor function loss, can result in sensory disturbance, and other neurologic symptoms. And we always try conservative care first. We'll try physical therapy, which can be helpful, epidural steroid injections to relieve the pain, even if it's temporary. And surgery has good results if it comes to that. It's something that we can use to alleviate these problems and restore normal function and return you back to your life. So the final point on the triangle of pain is spinal deformity, which is what we're going to talk about next. And spinal deformity really is a kind of accumulation of some of the other conditions that we've already discussed. So let's go back to our schematic here of the spine, the two vertebrae and the disc. And we'll put the spinal canal in there. And let's add a little bit of disc degeneration. And sometimes when the disc degenerates, it does not do it symmetrically. Sometimes it generates a little bit of laxity in this segmental unit. And when that occurs, the vertebrae can slip on one another. And I'm sure you've heard, or maybe someone in your family has had a quote unquote slipped disc. Well, this is a slipped disc. This is what it means. It means that one vertebrae is no longer sitting perfectly on top of the one that's below it. And we have a very fancy medical term for this. It's called spondylolisthesis. We just abbreviate this, we'll call it spondy in my field. But that just means a slipped disc. And when the disc slips, it can cause stenosis, and it can cause a lot of the same symptoms that just bread and butter stenosis can cause. When the disc degenerates in an asymmetric fashion, it can cause rotation and curvature of the spine. And that's also a condition that you may have heard of called scoliosis. And scoliosis can occur in adolescents, but it also occurs in adults, unfortunately. All the symptoms are basically the same with spinal deformity. You can have disfigurement, you can have severe low back pain, radiculopathy, which includes numbness and weakness of the legs, as well as the sciatica, which is the pain shooting down the legs. And again, it can be a very, very debilitating condition. And unfortunately, just like stenosis, spinal deformity and scoliosis is very common. It's estimated that about 70% of patients will develop some form of spinal degeneration or spinal deformity as they age. And so the treatments are the same as the treatments for stenosis. We try medications, we can try physical therapy to strengthen the muscles around the back, and we can try injections, but I think most reasonable people would imagine that an injection is probably not going to do a lot to treat a spine that looks like this. And so when the symptoms become severe, we do consider surgical interventions for these type of conditions. And so this is just a case illustrating a spinal deformity. This is a spondylolisthesis, or a slip disc. And what we can see here is that this vertebrae here has slipped forward on this vertebrae, and that's causing the spinal canal here to become pinched and a lot of excruciating pain for this patient. And in this case, we elected to treat this patient with what's called a spinal fusion. which is another term you may have heard. And what that means is that we put screws in this little device here is called a cage or an interbody device to basically reconstruct the normal column and the normal disc space and to return the anatomy to its normal shape. And so you can see here that with the screws, we were able to pull that vertebra back into place and restore it to what it once looked like, or at least the overall shape to what it once looked like. And when you do that, it relieves the stenosis in the spinal canal. It relieves the back pain because this vertebra is no longer moving in a pathological fashion on top of the other vertebrae and can offer tremendous relief to patients. So just to go through that progression once more, we can see here that the vertebrae is slipped. It's very painful. It moves back and forth in a way that's painful. And we reconstruct the disc space with screws and rods. And this may look surprising to some of you out there who not have experience with this, but rest assured that this patient is very happy and functional at this point. A lot of patients say, well, spinal fusion is going to decrease my overall mobility. It's going to make me walk around like Frankenstein. And I can tell you that this patient is walking much better now than they were when their condition was untreated, and they have more mobility and overall more satisfaction with their life. And it's not just from my own personal experience that I'm telling you this. Again, these conditions have been studied extensively with high quality randomized controlled trials and have been proven to be effective as compared to basic conservative therapies. So at this point, you're probably thinking, it's all bad. We're all destined to age. We're all destined to develop spinal stenosis. It's incredibly common. We're going to all get osteoporosis and suffer from compression fractures. And there may be a certain amount of shock and disbelief at this point in the talk. But I'm going to propose a little bit of a scenario to you. And if I told you that you could have perfect teeth without ever visiting the dentist or without ever brushing your teeth, I think you would probably tell me that that was false, and you would be right. But how many of you out there have thought about ever taking care of your back on a daily basis? I would imagine that very few people on a day-to-day basis actually think about taking care of their backs as you do take care of your teeth every day. We're trained from a very young age to brush our teeth in the morning and the evening, but we have very little protocol in Western society for how to take care of our backs. We sit for prolonged periods of time. We don't exercise. Our diets are poor, and we expect our backs, which is this incredible organ system, to function perfectly forever, and it's just not true. So what I would propose is that there are ways that we can take care of our backs, and we have this wealth of knowledge now for how to do that. And I institute for my patients a back program. And what that consists of is basically a series of exercises to strengthen and improve flexibility in the back on a daily basis. I think of this as brushing your teeth, but really it's like brushing your back. And it's something that we can all do in a very simple fashion, just make sure our backs are always functioning appropriately, and we're always trying to take good care of this structure that allows us to live our upright life. Weight loss and maintaining your weight is obviously very important. As you learned earlier in this talk, all of the weight that we carry on our abdomens and upper bodies is transmitted through the spine into the legs. And so just like carrying a heavy backpack increases the strain on the spine, so does carrying additional fat around the abdomen. So weight loss is an important component of maintaining your back. And we're learning now more about how diet impacts our muscles and our bones. And having a healthy, well-balanced diet is important, not just for preventing osteoporosis, ensuring adequate calcium intake, but we know that processed foods and other various foods can actually increase inflammation around the back, can predispose you to low back pain. And so having a healthy diet is an important component of taking care of your back. And all these areas are areas that I discuss with my patients, and trying to improve their backs and try to implement protocols that can prevent them from having bad backs. I have a lot of patients who come and see me and they say, well, I don't want to be like, I've seen what happened to my mom, or I saw what happened to my grandfather, and they had this terrible outcome with their back, and I just don't want to be like that. What am I supposed to do? And essentially what I prescribe is a combination of these things to try to maintain their back strength. And we think that this will really help in preventing back problems as you get older. So it's not all bad. And even if you do have some back problems, these protocols can be very, very helpful in preventing aggravation of those problems. And so we've just had a brief time together tonight, but I would invite everyone, if they're interested in learning more, to check out the Spine Encyclopedia, or even come and see me for a consultation, and I'd be happy to discuss these things with you in greater detail in the future. And so I think we'll be taking some questions now at this point, and thank you all for your attention.
Great. Thank you so much, Dr. Katsuura. That was fantastic. And we have about 20 questions in the queue, which is terrific. A lot of participation tonight. And I also want to remind people that even as Dr. Katsuura is answering questions, you could still ask them by clicking the Q&A button in the bottom and typing your questions in. So, and one disclaimer, Dr. Katsuura cannot diagnose everybody's specific problems, but in generalizations, he will give the best answers possible. So I'm really excited. We got great questions here. So let's start with the first one. First question is, I had ACDF surgery 5 years ago and still have chronic pain requiring medication. Is this a typical outcome of spinal surgery?
That's a really great question. And I think that that's actually a difficult question to answer without knowing the specific circumstances that were with your case. I think in most cases, spinal fusions tend to be painless situations, but there are certain cases or certain instances where spinal fusions can become painful. And one of those instances is where the spinal fusion fails to heal. One of the goals that we have in spinal fusion surgery is to basically link that spinal segment together so it no longer moves and ultimately grows together. When that fails to occur, we call it a non-union or pseudoarthrosis, which that means is that we failed in preventing the motion from stopping at that segment, and that can be a painful condition. And so what I would recommend in your situation is further evaluation and workup of your problem. And I would say that ultimately, no, that's not an expected outcome of spinal fusion surgery.
Great. Thank you so much. The next question we have is sciatica a precursor to stenosis? Can you again review the relationship between sciatica and stenosis? And are the treatment options any different when both conditions are present?
That's a really great question. And I feel that a lot of patients are confused by these terms. So stenosis and sciatica, they're all over the internet and they're thrown around very, very commonly and loosely. And so let's just clarify what those terms mean. Sciatica basically just means that you have pain shooting down your leg in the distribution of how the nerves run down your leg. So it's an electrical sensation, electrical pain that travels from your low back through your buttocks, down your thigh, into the calf, and into the foot. That's quote unquote sciatica. That's all that means. It doesn't necessarily have to be related to stenosis. You can have sciatica caused by many different conditions. Anything that touches or pinches that nerve can theoretically cause sciatica, anything that touches the sciatic nerve, which is the main nerve in the leg. And stenosis is just one of those conditions. So when you have stenosis, obviously the nerve is pinched in the spinal canal as it exits and travels down your leg. That can cause sciatica. But sciatica is really just a symptom. It's not a diagnosis. So stenosis is a diagnosis, and it's one of the diagnoses that can cause the symptom of sciatica. So I hope that clarifies that a little bit for you.
Great. Thank you so much. The next question is, I have a severe compression at C5, C6, and C7. What are the best 2 or 3 core exercises that you showed?
So by compression, I'm assuming you mean stenosis and narrowing of the spinal canal. And for the neck, physical therapy is much more difficult to prescribe. And I do recommend in your case being evaluated by a spine surgeon or some sort of spine specialist if you have compression in the spinal canal before you attempt any exercises or physical therapy or things to do at home for that problem. So that's a very nuanced question, and I would probably defer to your medical doctors and experts, but I would have an evaluation before you go seek any physical therapy or chiropractic, because in certain cases, if you have severe spinal cord compression and you do exercises, it can result in worsening of your neurologic condition.
Thank you very much. Next question, Doc, is what are your opinions on inversion tables for back pain, and can they cause damage?
That's another very common question that I get all the time. And these inversion tables or totter tables, just for people who don't know, are basically something that you can lie down on, and your ankles are strapped in at one end and you crank it over. And so you're basically inverted and hanging from your ankles. And the idea behind this is that your spinal column is lengthened and you stretch out, and you can have relief of your stenosis and sciatica from doing this. And I think actually patients can get relief from doing this. The problem is when you stand back up, your spine goes back to its normal configuration. And it doesn't offer permanent or sustained treatment for stenosis, but it can result in temporary relief. Obviously, you have to be very careful when using one of these devices, and probably it's best to do it under the direction of your physician. I think it can offer temporary relief, but it's really not a mainstay in treatment in my clinic.
Great. Thank you very much. We have a lot of questions coming in, so this is great that we have such an engaged patient crew here. The next question is, what are your views, doctor, on TENS units for back pain relief?
So I'm really grateful for this question. I was recently approached by a family member of mine who asked the exact same question. What is a TENS unit? Should I be using it? And how can that help me? A TENS unit is a somewhat physiologically complicated device. What it does is generate an electrical current. You carry around a little electrical generator with you, and it has electrical leads that you place on the skin in an area where you may be experiencing pain. And you turn it on and it creates this buzzing sensation. And long story short, it's a distracting stimulus. And so it basically jams the pain signals as they try to reach your brain from your body. And your brain does not interpret the pain in the same way. And that's how TENS units work. And they can offer relief. They as soon as you turn it off, it's just like the inversion table. You kind of go back to normal and your pain can start again. But if you're at home and you want to just use it for a little bit of relief, I think it's a worthwhile thing to try. And physical therapists are also very good at helping you place the electrodes and use these devices appropriately. So I do think you should do it in combination with a medical expert.
Great. Thank you very much. This next question is a little long, but I think they're just seeking for next steps. So I'll read it to you. I'm 45 years old and have struggled with pretty severe neck pain for the last 5 to 7 years, progressively getting worse. I can't turn my head left or right without pain on any given day. I was in a car accident and I have arthritis in my neck, but I'm looking for options to alleviate the help with the pain. I've never had an injection or taken specific meds for the pain other than ibuprofen. I also have lower back pain with sciatica. I'm just looking, doctor, for advice on what kind of professionals I should look towards for treatment options.
I'm really sorry to hear about your situation. I'm sorry to hear that you're experiencing such pain. And I know that neck pain and back pain can be very, very, very disabling and can ruin your quality of life. So let me just start with that. As far as seeking medical care, I think the best place probably to start is with working with your primary care physician and establishing a diagnosis. I think a lot of people want to skip that step. And in my clinic, just like I showed in the very beginning with my brochure, I really focus on let's figure out what's going on. Let's figure out what the source of the pain is. Pain can be caused by a lot of different things. And so establishing a diagnosis is probably the most important. It sounds like you've already had a little bit of workup and you know that you have arthritis in the neck. Probably next steps may be to see a pain specialist and potentially even a spine surgeon. Just seeing the spine surgeon doesn't necessarily mean that you're going to go for surgery. I think that's the last thing I think of in my clinic is the last option for treatment is surgery. And I also consider myself an expert in non-operative care and helping people who are not ready or don't need spine surgery is a component of my practice. And so I would, no one knows the spine better than the spine surgeon. I would encourage you to try to seek someone out to try to get some relief.
Great. Thank you very much. That kind of leads into our next question, which is, are there long-term risks with facet joint injections and ablations in the lumbar spine? Can the injection material itself cause harm?
These are really great questions, and I'm really enjoying these questions. So the answer to that is likely yes. Facet injections, just for people who don't know, when we go back to the spine, we see the vertebrae and the discs, but I didn't really mention the facet joints, which are these two seashell type shaped bones that connect in the back of your spine. They block certain motions and allow certain motions to occur, and they can experience arthritis just like any other joint in the body. And so one of the treatments is called a facet block or facet injection. And how that works is we take a needle and we place it very close to the nerve that goes into this joint that transmits pain from the joint to the brain. And we apply numbing medicine or steroids in that area. That's called a facet block. And the idea behind that is if we block the nerve that innervates that joint, it won't experience pain, even if it has arthritis. And so an extension of that is called a facet ablation or medial branch block, which basically is performed with a small cautery that burns that nerve and destroys it, so it no longer functions properly, and then you can't transmit pain as effectively. And I think these are effective treatments for low back pain and are appropriate in certain situations. You have to work obviously with your pain management specialist or surgeon to determine when that situation is appropriate. But over time, I think if you have a problem in your back, it probably needs to be evaluated and see whether or not there is another option for treatment. Steroids have long-term effects on the bones. They have systemic effects as well over time, can cause your sugars to elevate, may not be appropriate if you have diabetes. The ablations are very safe in general, and they only provide temporary relief. They can be used multiple times. And I'm not aware of any studies that show that they have long-term effects, but I do know that they block the pain from being transmitted, and that can ultimately result in you not knowing that you have a problem, and you can continue to damage your spine because you're unaware that there's a problem. And the one important thing that I always counsel my patients on is that pain is an unpleasant experience, but it serves a purpose. It's your body's only way of telling you that something is going wrong. Otherwise, you don't have a clear idea of knowing when you have an injury. And if you don't know that you have an injury, you can continue to damage yourself. Having no pain is actually a potentially dangerous situation because you become unaware of when you are doing further damage to your spine. And so I think theoretically there can be a long-term downside effect to having multiple ablations, but once or twice, I think is relatively safe. And thanks for that excellent question.
Great. Thank you very much. The next question is, and you'll have to excuse me if I mispronounce some of these things. Great talk, Dr. Katsuura. You mentioned stenosis. Is foraminal narrowing and mild canal stenosis better treated with surgery or physical therapy?
That's a very excellent question, and I think that is something that a lot of people, even physicians, will struggle with, but my answer is physical therapy. I generally only recommend surgery for very severe cases of spinal stenosis. Mild cases are best treated with physical therapy because you still have life in your spine. Your spine has not gotten to the point yet where it's going to be only surgery can fix it. Mild stenosis can be treated with physical therapy, exercise, potentially even injections, and managed very well. And I do so with success on a regular basis in my clinic.
Very good. Thank you so much. Actually, we've had about 4 or 5 questions on this topic, so I'll just ask them all in combination. What's the difference between an orthopedic specialist and a neurosurgeon for spine conditions?
Well, I think in almost all regards, orthopedic surgeons are superior. I'm actually being a little bit facetious because I'm an orthopedic surgeon. That's traditionally there were a lot of differences between neurologic surgeons and orthopedic surgeons, and we had different training. But when it comes to spinal training, it's actually very similar these days. The orthopedic specialist is well poised to deal with musculoskeletal problems, not just in the spine, but throughout the entire body. And I think that this is a significant advantage. One, because you may come to me and say, well, I have a bad back, I need back surgery. And you tell me about your symptoms and we kind of work you up a little bit. We find out it's your back's really not the problem here. It could be another structure. It could be your hip or something else. An orthopedic specialist is really well trained to ferret out these different diagnoses and different pain generators. Neurosurgeons are obviously very well trained as well, but they don't have that same experience with the entire body as an orthopedic surgeon does. They deal a lot more with cranial issues, with brain issues, but also treat spinal conditions as well. I think ultimately you're going to be well served going to either one.
Great. Thank you very much. This next question I think I could answer, but I will recite it anyway. Thank you for your time. I really liked your graphics and easy to understand explanations. You presented a lot of information here, and I'd like to have a copy. Can you make this available? And the answer is yes. When you fill out the form, the referral survey form, just let us know, and Robin at Dr. Katsuura's office will send you the link. All right. Next question for the medical professional is, could my disc movement indicate spondylolisthesis, and is spondylolisthesis the same as spondylosis?
Well, let me answer the second part of that question first. So the two terms being discussed here are spondylosis and spondylolisthesis, and these are complicated medical terms, and they are not the same. Spondylosis generally refers to the degenerative condition of the spine. It's a broader term that we use to describe arthritic changes throughout the back. So those bone spur formations that we talked about earlier in the presentation, that could be referred to as spondylosis. Spondylolisthesis is the condition of slippage of the disc on the inferior disc or the inferior vertebrae. And so that's a totally different thing. But spondylosis and spondylolisthesis commonly occur together. There's one other term called spondylolysis, which is basically what it means is there's a break in the bone that allows the spondylolisthesis to occur. And so all these terms are very confusing for patients, but I like to keep it simple. I like to say, okay, you have a slip disc, which everyone can understand, one vertebrae slipping on the other. Or you have degeneration of the spine, you have arthritis in the spine with bone spur formation, spondylosis. If you have a break in the back part of your vertebrae, that can cause the slip to occur. That's called spondylolysis. I just say there's a small break in the back. It doesn't necessarily mean that you've had a fracture or trauma. It just means that there is this disconnection between the two vertebrae.
Great. Thank you very much. The next question is, actually, I have two questions. Number one is, are you accepting new patients, is the first question. And number two is, a primary care referral needed to see you for chronic pain, back pain?
The answer is I am accepting new patients, and you don't necessarily need a referral to see me, but I generally prefer people to see their primary care physicians before seeking specialty care, but it's not necessary in all cases.
Great. Thank you very much. Next question is, my 70-year-old wife has pronounced scoliosis. What exercises or treatments can help her?
So again, that's a great question. And we know that scoliosis is very common as you approach your mid-60s and 70s. So it's a very appropriate question. A lot of people are going to have to be dealing with this. And I think the general scope of the question is probably a little bit beyond what I can answer today in full detail, but we would put you on a back program. The back program basically consists of strengthening of the muscles around the spine, improving the flexibility, and trying to prevent osteoporosis. So as the osteoporosis gets worse, you can have disfigurement of the vertebrae and the scoliosis can progress. So we prevent osteoporosis by weight training. And we all know if you go into space and you're not exposed to gravity anymore, your skeleton can deteriorate very rapidly. You can develop rapid osteoporosis in that scenario. And so what we're doing, what you're going to try to do down here on Earth, is to increase the gravity by doing strength training and try to make sure that the spine does not undergo the same rapid degeneration. And so I think probably you would need to do a little bit of research, or perhaps consult with a physician for how to establish a back program and learn the specific exercises.
Great. Thank you very much. The next question seems to be another healthcare navigation question, so I'll just read it for you and maybe you can provide some advice. I have osteoporosis and scoliosis. I am not in any pain and I want to stay that way. I don't take any meds for this. I do take calcium and vitamin D. Are you the doctor I would see? If not, who do I see? I want to remain pain-free.
I think that's a really excellent question. And osteoporosis is one of the conditions that I'm very passionate about because I love keeping active elderly people active. And so I am a physician that you could consult, but you can also consult your primary care physician. Your osteoporosis needs to be managed. It needs to be evaluated, perhaps with a bone density scan, and treatment needs to be applied if necessary. And that's best done by a physician. Primary care physicians are very good at doing that. You could also see an endocrinologist who specializes in bone metabolism. Or ultimately you can consult with a orthopedic surgeon or a physical rehabilitation doctors. I think any of those physicians would be well qualified to help you with your problem.
Great, thank you very much. Another navigation question here is, I've had ACDF surgery several years ago. I have since developed pain on the side of my neck, the facet joint, I believe. I've had several steroid injections and ablations, but to no avail. I have substantial arthritis and pain in this area, and a CAT scan showed that the disc material has worn away. I've heard that hyaluronic acid may be a way of generating cartilage. Is this true? And could this be a helpful approach?
That's a really interesting question. And I've done extensive research on these topics, and I am not aware of any studies that support the use of hyaluronic acid injections in and around the spine to regenerate the spine. That technology, unfortunately, is not matured yet. And so I think the short answer to your question is no. I'm not aware of any sort of rejuvenating hyaluronic acid injections that can treat your problem.
Great, thank you very much, and thank you for answering such detailed questions here. We've got another one just typed in. I take 300 milligrams of gabapentin daily along with physical therapy and acupuncture to manage pain associated with a herniated cervical disc C5, C6 right, with none spurred, and C4, C5 left. Would you say, is it okay to continue on gabapentin, or should I go ahead and just do surgery? I've been dealing with this issue for a year, and I've already had 3 injections, and I don't want to take another one.
So let me address the gabapentin first. Gabapentin is a very old medicine. It was originally an anti-seizure medication and was used to treat seizures. And we basically, through its use, found that it can also be used to treat neuropathic pain. Neuropathic pain is pain generated from the compression of the nerves and can be excruciating. And so it's a medicine that kind of decreases the reactivity of nerves and can alleviate some of that sciatic pain. It is a very safe medication in most instances and can be taken for prolonged periods of time. It does not necessarily cause habit formation, and the side effects are usually quite minimal, especially at a low dose like 300. So it is something that you can continue if it's offering you relief. I would say, yes, you can continue with it, and you can perhaps even decrease the dose as you continue to use it, so the side effects are even less pronounced. But again, all medicines have side effects over time, and there's no one medicine that you can take forever. And with the repeated epidural steroid injections, if you've already had 3 and you're continuing to experience a lot of symptoms, I think it would be time to at least consult with a spine specialist or spine surgeon to see if there is a surgical solution, because again, repeated injections like we discussed earlier, not necessarily a healthy or good thing to continue doing. So thanks for that excellent question.
Very good. Thank you so much. We have a couple of questions about supplements. Are there supplements that can help slow disc degeneration? I've heard about omegas and B vitamins and cartilage formulations. Are these hocus pocus, or do they help?
That's another very interesting and very common question. Is there a silver bullet that's going to cure my aging back and prevent it from getting older? The short answer is unfortunately no. The supplemental industry is geared towards selling you supplements. They want you to buy them, and this is like littered across the internet that taking certain supplements will alleviate your pain, will rejuvenate your back, make you more youthful, etc. It's just not true. The science behind supplements is not rigorously tested, and ultimately, it has not been proven that there's any specific supplement that's going to leave you with a more youthful spine. But that having been said, I think the solution is actually much more simple than that. I think it comes back to just maintaining a very healthy, well-balanced diet, and having a very healthy diet is nurturing for your back and can provide the back with the appropriate nutrients to maintain its strength and have an appropriate metabolism. And so I think the solution is not necessarily trying to supplement and do different things. It's just having a healthier lifestyle and a healthier diet. I can't go into all the details of what that consists of tonight, but I do think that there is a way for you to preserve your back, and you don't necessarily need to take supplements to do that.
Thank you very much. The next question is, I have cervical spine problems and I'm really scared. I have disc degeneration in my neck. Is it possible to rebuild the discs in the neck?
Thank you very much for that question. And again, I'm sorry that you're experiencing fear and perhaps even pain. And the answer to your question is cervical degeneration is very common. I think everybody will experience it in their life. It's not necessarily something that we should be afraid of. It's a natural part of the aging process, and in a lot of cases can be asymptomatic. And so it's not necessarily something that you should be afraid of just in and of itself. But if it is causing you pain and it is reducing your quality of life, I would first recommend establishing a diagnosis and then offering treatments that are relevant to that diagnosis. And so, yes, I think there are ways to reconstruct and rebuild the spine with surgery. There are a lot of different ways to do that these days. There's really an array of treatment options that we have. And so it is one of the reasons why orthopedics is such an amazing specialty to practice, is that we have all these tools now to basically keep people going longer and with better quality of life, with more strength and able to participate in the activities that they enjoy. And it's why I come to work every day. So I would caution you against having despair, and hopefully offer you a little bit of hope that there are ways to treat certain conditions. We can't treat everything. Some conditions are beyond what we have, but I do think that in this day and age, we have lots of different options for things. So thank you.
Great. Thank you, Dr. Katsuura. The next question is, sounds like a navigation question. We only have a few more. I have moderately severe degeneration of the C3 through 7 discs from a 30-year-old event, which had an ischemic neuropathy that affected my vision, requiring me to hold my head bent to the side to see accurately. I'm pursuing non-surgical remedies, but the vision issue isn't improving. Is a surgical solution reasonable, and is it available?
So I think this question is asking about improvement in vision. Is that correct, Sean?
It sounds like it.
The vision is not related to the spine, and so vision is completely independent and is supplied by a different area of your nervous system than one that is related to your spine. And so spine treatment would not have improvement in your visual capacity. That's not something that I would recommend surgery for.
Great. Thank you very much. We're on the last couple of questions. The next one is, in a situation where I have stenosis and osteopenia and a steroid injection didn't really help to address the sporadic pain. Am I still at a stage where exercise and taking calcium and vitamin D is the best option, or are you in surgery next?
I think that's a really great question. Again, a very common question. I'm having pain in my back. I have osteoporosis. I have some stenosis. I tried an epidural steroid injection and I'm not getting any better. What's left for me? And I think that's a very personal question. And it's a question where I have a very frank discussion with the patient about what their goals are. And if it's something that can be treated with surgery, it's something that we may consider depending on what the goals and overall philosophy of the patient are. Some patients are just against surgery as a treatment. And I respect that. I think that, everyone ultimately has to make their own decision about what they want for treatment. And my job really is to act as a Sherpa of sorts and just guide you along that journey and walk that path with you. And so we would explore the options and see what's available. And really, it's a risk-benefit analysis for me. I offer surgery in situations where the risks are really nowhere near what the benefits would potentially be. And so if it's something that's easily treated with surgery, it may be something that you would consider. But again, it's dependent on your individual case.
Great. Thank you very much. Next question is, thank you very much, Dr. Katsuura. I am 64 years old and in good health. I swim open ocean 3 times a week and have a healthy diet, but I drive 2 hours a day in stressful conditions and come home every night with a pain in the middle of my shoulders that's getting worse. Obviously, it's from the stress of driving and some time behind a computer. What is the best way to counter this type of pain?
That's a really relevant question, and it's something that I think a lot of people can relate to. You're a healthy individual, you exercise, you eat well, but you're part of this Bay Area Western culture that involves a lot of driving and sitting in the car, potentially in traffic, which is stressful and aggravating. You may also work at a desk job where your ergonomics may not be optimized. We know that sitting for prolonged periods is bad for the discs. The discs are healthiest when we move. When we move, the discs are supplied with increased nutrition and they don't suffer metabolic insults. And so sitting in a stationary position for a prolonged period of time is an accelerant for disc degeneration. And that's something that I'm fairly convinced of. So how do we mitigate that situation? Well, I think making some sort of lifestyle changes here could be appropriate. Is there a way to change when you do your commute or how you do your commute? Can it be broken up in some way? What kind of supports are you using in the car? Do you have a lumbar support in the car? Is your spine in the appropriate position? There are ways to mitigate the damage that's done from being in a sedentary position. When you're in front of your computer, are you taking breaks? Are you standing? Are you going for a stretch every now and then? Do you do it on a regular basis? So these are all questions that I would ask of you. And I think that your situation is one that can be modified. And that's hopeful. I hope that to kind of set you in the right direction.
Very good. And this is a related question. The next one is, I'm in my 50s and I work at a desk job. I have no preference sitting or standing. Is one better for your long-term spinal health?
These are really great questions, Son. I'm really enjoying myself answering these questions because they're right up my alley. And these are the things that I think about every day. And that's a really great question. And I have a hopefully a very succinct answer. Standing is better. Standing, you'll move around more. Your spine will be in the appropriate position. You won't be stuck in this, like how I am right now, slouched over and having my discs loaded in an abnormal way for a prolonged period of time. So standing is the way to go.
Great. That's terrific. Certainly an easy solution, right?
Definitely.
Next question, and we're down to our last two. Sounds like an avocation question here. I have had chronic back pain for years. My primary care physician has advised me to get a new mattress. 2 mattresses later, I went to an orthopedic surgeon. They did an x-ray and only had me see the PA. He said that I had mild arthritis and sent me on my way with no recommendations. I'm getting treatment for osteoporosis already. My pain is worsening over time, and it hurts to bend over and garden more than a few minutes. What do you suggest as my next steps?
Well, that's a really complicated question, and I think it has a lot of angles to it. It sounds like initially there you're recommended to have a new mattress and may have tried different mattresses, and you may have gone to see a surgeon, but you saw the physician and assistant instead, and maybe not have had like a total workup. And so I think really starting from scratch here is probably the way to go. Have a thorough evaluation by a spinal specialist. Sounds like you are suffering and things are not getting better, and that's not something that I like to see. So I think probably having an evaluation by a spinal expert is in your best interest to determine A, what's going on, and two, what can be done about it.
Very good. Thank you so much. And our last question is, is minimally invasive surgery using lasers effective for herniated discs?
I'm really grateful that you asked that question. Again, the internet and everywhere is littered with these different treatment options, and there's lasers and there's minimally invasive, and these are terms that are thrown around all over the place. And so I'm grateful for the opportunity to provide a little bit of clarity. Let's first talk about what minimally invasive surgery portends to be. And basically what it means is that you're going to accomplish some goal in the spine with very little tissue dissection. And there are lots of new treatments that are expanding on a daily basis for how to do that. And I do offer some of these treatments in my clinic. Historically, there have been tons of different minimally invasive treatment options offered, some with very poor outcomes and very little success. And the use of lasers was one of those treatment options that just had lots of complications. And the idea behind it is that you use a high-powered laser to burn through the disc and recontour it. And if that sounds unsafe to you, I think you would be correct. I mean, most people would not think that that's a safe option, and I think that's what's proven to be true. Is not used in mainstream spine surgery or mainstream spine medicine. It is offered as a marketing gimmick primarily.
Very good. Thank you very much. Really appreciate it so much, Dr. Katsuura. We had a great time this evening. A lot of participation. We do want to remind people that at the end of the evening, they will see a survey referral form that will pop up in their browser. Please give us some feedback on how you like the session. If you don't see it, we'll email it to everybody tomorrow. And it'll give you also the opportunity to ask any additional personal questions you may not have been able to ask tonight, and to schedule a consultation with Dr. Katsuura if you're interested. And with that, I'll leave the last couple of words for the doctor.
Well, I want to thank everyone for your attention tonight. I really enjoyed all those questions. They're very, very topical and very relevant for a lot of people. And these are the kind of things that I ponder all the time. And I've spent a lot of time researching to find the most appropriate scientific evidence to support these things. So I really enjoyed the talk tonight. And I hope that if you're living with back pain, that you know that there is hope. Thanks.
Thank you so much.